Hello and welcome. Today we're going to talk about something important for men, especially those over 60. It's called prostate cancer. That may sound scary, but don't worry. We'll take it slow, explain everything in simple language, and help you understand what it means, what signs to look for, and how to take care of your health. Think of this like a friendly chat, just like we would have at the village square or after church. So let's begin. First, what is the prostate? The prostate is a small gland found only in men. It sits just below the bladder and in front of the rectum. It helps make some of the fluid that carries sperm. As men grow older, the prostate can change, and sometimes problems can happen. Prostate cancer happens when cells in the prostate start to grow in a way they shouldn't. In many men, this growth is very slow. Some men may live a long time with it and not even notice. But for others, it can grow quickly and even spread to other parts of the body, like the bones or the nearby glands. Often, in the early stages, there are no signs at all. That's why regular checkups are so important. All men can get prostate cancer, but some are more at risk than others. You may have a higher risk if you are over 60 years old. Someone in your family, like your father or brother, had prostate cancer. You are of African or Caribbean heritage. Doctors aren't completely sure why African men are more affected, but it's something they're still studying. Even though many men don't notice any symptoms at first, there are some warning signs you should know. These can include needing to urinate more often, especially at night, trouble starting to urinate or a weak stream blood in your urine, or semen pain, or burning when urinating, pain during sex, aching in your lower back, hips, or thighs, especially if the cancer has spread. If you notice any of these, please talk to a doctor. It doesn't always mean cancer, but it's best to get checked. There are other prostate problems that are not cancer, but can feel similar. Enlarged prostate, BPH. This is very common in older men. The prostate gets bigger and presses on the bladder, making it hard to urinate. It's not cancer, and it can often be treated with medicine or sometimes surgery. Prostatitis, prostate infection. This happens when the prostate becomes swollen due to an infection. It can cause pain and problems passing urine. Antibiotics usually help, so remember, just because you have symptoms doesn't mean it's cancer, but you should always get checked. Yes, what you eat matters. Some studies suggest that eating more fruits and vegetables, especially tomatoes, leafy greens, and beans, may help lower your risk. On the other hand, eating a lot of red meat or fatty foods may raise the risk. So, try to eat more fresh, natural foods and drink plenty of water. It's not just good for the prostate, it's good for your whole body. Now let's talk about how to find prostate cancer early. There are two main tests. PSA test. This is a simple blood test that checks for a protein made by the prostate. DRE test. This is a short physical exam where a doctor gently feels the prostate through the rectum to check for anything unusual. These tests don't always mean you have cancer, but they help doctors decide what to do next. If the results show something unusual, a small sample from the prostate, called a biopsy, may be taken and looked at under a microscope. Not every man needs these tests, but it's worth talking about if you're over 50, you're 45 and have African heritage or a family history, you're 40 and had close relatives who had prostate cancer. Early, talk to your doctor and ask what's best for you. Living well with or without prostate cancer. Many men live long and healthy lives even after being diagnosed with prostate cancer. Treatment depends on how fast the cancer is growing and your overall health. Sometimes, if the cancer is very slow, the doctor may suggest watchful waiting. Other times, treatments like surgery, radiation, or medicine may be recommended. The most important thing is not to panic. Stay informed, keep up with checkups, and live a healthy lifestyle. The following are questions men often ask. Let's go over a few common questions. Will prostate cancer affect my sex life? Yes. Treatment may affect your sexual life, but there are ways to manage them. Talk openly with your doctor. Can it be prevented? There is no sure way to prevent it, but healthy habits like eating well, staying active, and getting checked can lower your risk. Should I be afraid of the tests? Not at all. They are quick and often painless. It's much better to know early than to wait. Dear friends, your health matters. Prostate cancer can be serious, but many men beat it, especially when it's found early. Take care of your body. Eat well. Pay attention to changes. And please, don't be shy to talk to your doctor. Remember, checking is not a sign of weakness, it's a sign of wisdom. Goodbye, and don't forget to like and subscribe for more health educational video.